Hey everyone! So today I'm going to talk to you about braces. I received a request with a couple of questions from a subscriber that's going to get braces soon, so I thought this was a good universal topic that a lot of people would like to know about. So first I'm going to talk to you about my experiences with braces and how I keep up my oral hygiene, and also what I know about other kinds of braces so I can educate you in every way that I can. I had known that I needed braces since I was 13, but I didn't want to get it. I thought that would be really embarrassing to me, but I really regret that decision because everybody in the first couple of years of high school has braces. The majority of your friends, I assure you, will have braces. I wish I had gotten them when I was that age. I ended up getting them when I was in college, and it's uncomfortable because now I have to have braces for 2 years while I'm in college, but that's just a guesstimate. It can change, it can be longer, it can be shorter, depending on how well your teeth take to the procedure and how straight they get, how quickly, and what kind of braces you get, because that can depend on the lifespan of how long you have to keep them. With the kind of problem that my teeth have, I couldn't get the Invisalign. If you have an overbite, not in all cases, sometimes they can be fixed with Invisalign, but just the way my jaw was positioned, I could not get Invisalign because it wouldn't move my teeth in the right way. And it's definitely harder to clean your teeth with the metal kind because then you have to buy special floss to floss your teeth, and flossing is really important. Honestly, I don't floss as much as I should. I need to floss more. But it's a really important part of your dental hygiene because when you brush your teeth, it's not going to get in between the metal brackets. So here I have Oral-B Superfloss, and I'll show you what it looks like. This is the only way to get into your teeth. It comes with a pack this long. So this is what floss looks like for if you have braces. It has a thick part here that has a cushion, and then a thin part here. It's called threader floss. So you literally push this up through your brackets, and then the squishy part is supposed to clean around your braces. And then it goes back into here so you can go in between your teeth. So that's what floss looks like for if you have braces. And it is very important to floss. Use mouthwash. If you can, get a prescription toothpaste. The one that I use is called Prevedent. I actually ran out of it, so right now I'm using the Aquafresh Iso-Active Whitening toothpaste because it comes out as a big foam, so then it gets in between all of the areas of your teeth. But if you can get it, get Prevedent. I believe it costs $12 per bottle, and mine lasted for about like 2 or 3 months. It has prescription fluoride in it because since you're not going to be able to brush and get into all of the areas, it's unavoidable that you're going to miss some spots. Having extra fluoride will help keep your teeth strong. I use a pre-brush whitening rinse. It actually says Guru on it because when I was starting my channel and I wanted to present myself out there into the world, I'm like, okay, I need to take better care of myself. So I have 2 mouthwashes, and it says Guru, do it, as like a motivating thing, which is really strange. But here I have the generic kind of Listerine whitening pre-brush rinse, and that's this. So you rinse your mouth with this first, then you brush your teeth because then it scrubs away kind of like a bleach around your teeth. And then after I brush my teeth, I use Listerine whitening and restoring fluoride rinse. So then it helps increase the strength of your enamel while you're brushing your teeth, and it whitens it. And then you're also going to receive this from your orthodontist. It's a little spoolie and it comes with a cap. They break very easily though, so be careful. And it looks like this. It's kind of like a pipe cleaner, but for your teeth. So I'll demonstrate this to you, so if you don't want to see my teeth, then just skip a couple of seconds forward. But you take this and you go like that. See, in between your teeth, so it can help you get into the little nooks and crannies. It is really helpful if you have something stuck in your teeth, so make sure that you keep this with you at all times. Another thing that your orthodontist is going to give you, and it's going to especially be useful the first couple of months you have braces, is a little container of wax. And because your gums and the area inside of your mouth is not going to be used to the braces and the metal inside of you, so it might chafe or rub against the side of your mouth, and you could have sores in your mouth. My mouth got used to this really quickly, and I didn't need this after the first 2 or 3 weeks. When you first get your braces, it's gonna hurt, but it's not gonna hurt too much, you're basically just going to feel very sore because your teeth are basically constantly moving. That's what braces do. They realign your teeth to be where they're supposed to be by like pulling it with the wire. It's going to look like this. You just take a little piece of wax and then you just push it onto your braces where the area hurts, where it's rubbing, so then it doesn't hurt the inside of your mouth. The elastics, this is actually like my third pack, and each pack has 100. So when you yawn or cough, or if you laugh or smile really widely, the elastic is going to actually pop and break in your mouth. And you would think that would hurt, but most of the time it doesn't. Honestly, I don't even notice it except for the sound that it makes. What the elastics do is they keep you from moving your bite forward. Because I have an overbite, so I have to keep elastics in my mouth on both sides. Anyway, so that's basically what experiences I've had with braces so far. Now I'll get into some of the questions that I was received. How long have you had your braces and how long do you have left? I got my braces in September of 2009 and my estimate is September of 2011. The second question is, do you have any other braces stuff like expanders or anything else? Well, I don't have expanders, though I do have the elastics, the rubber bands. I used to use a retainer towards the beginning, but now I don't need to use one. What type are yours, like metal or the clear ones? Mine are metal. There's different kinds of metal and there's different kinds of clear. The clear ones that most people know about are Invisalign, and that's where it's kind of like a clear plastic retainer that you put onto your teeth, so it's not as noticeable that you're wearing braces. I think in cases like mine where I had an overbite and my jaw was a little unaligned, then I had to use braces, the traditional kind. There's a couple of different metal kinds. I'm actually wearing 2 different kinds of metal. The one on top is the more traditional one that you'll see, and the one on the bottom, I believe they're called Da Vinci's or something like that. It's a little more concentrated and powerful, and it takes a thicker wire, so then it'll work faster because my bottom teeth were worse than my top. Another point that I forgot to mention, then I'll get back to the questions, is that it is really important to try and keep your teeth as white as possible. When they take off the little brackets, you're going to have a clear distinction on your teeth, almost like a tan line on your teeth. So if your teeth get darker while you have braces, then you're going to have a white square in the middle of your tooth, and that can be very unattractive. So make sure to keep up your hygiene as well as you possibly can. The next question is, can you show some close-up views to show how they connect to your teeth on the middle, top, bottom, sides, and such? So I don't know if you guys will think this is gross, but I will show you a closer thing of my teeth. So that's my teeth. Kind of nasty, but I'm sure some of you were interested in that. And I had an overbite, and my bottom layer of teeth was somewhat crooked, and there was some issue with my jaw where it wasn't like closing quite right. So the metal braces did help with that. Around this area, I had one tooth that was totally slanted like that, and it was not attractive. How do they affect your smile? Or maybe they don't. Well, mine, I guess in a way it has affected my smile because I used to smile with my mouth open to show my teeth, but now I think my braces make me look a little younger, so I just smile with my mouth closed. And the last question is, have you been happy with them? Yes, I've been very happy with my braces. I'm very happy that I made this decision. There's this quote that I read that really connected with me on this subject, and it said something along the lines of, it's never too late to make the right decision. And that is very true, because if you need braces, get them as soon as you can, because it's just going to be more of a burden the older you get. Just to take this final note with you, if you need braces, don't be ashamed, don't be embarrassed. It is a total normal part of pretty much any teenager's life. The majority of people are going to need braces. So just take them in a stride, get them as soon as you can, and just be confident with who you are, because when you're done with these braces, your teeth are going to be amazing, and that is something to work towards. Well, thank you so much for watching. I hope to see you soon. Don't forget to leave a comment below if you have any questions. Bye! Love, it is love in my heart. Love is all I have.